think that the future of the fractional plasma RF is very bright in the area of medical aesthetics. Patients want to have treatments that are quick, that have minimal downtime, but that give them results. And with combining the RF with the plasma, you're able to do this with Opus.
If we've just started to scratch the surface of plasma radiofrequency treatment, the Opus has some very manicured nails.
The thought of harnessing and controlling the power of plasma for aesthetic applications seemed like science fiction at first, but after studying this device and finally applying that to a patient, I am now a believer.
Opus is the first aesthetic platform that features a proprietary high-frequency RF energy, unipolar RF, to create a fractional injury with plasma with Opus Plasma. Operating at over 40 MHz, the metal pins are supercharged with high RF voltage. When in close proximity of the skin, the RF-charged pins react to atmospheric pressure in the air, creating plasma.
What I've liked the most is the wide range of treatments that are available. There's so much to offer in terms of treatment levels. I'm able to use the glide tip to treat an entire face in less than 10 minutes. I also really like the focus tip in its ability to treat small areas such as under the eyes in an area where it's really hard to treat.
The Opus has several advantages that are immediately obvious to any user. It's extremely versatile. With simple parameter changes, I can produce results to match the most aggressive CO2 laser or the most gentle laser peel. Even at aggressive settings, I'm seeing very short recovery times. And we've only scratched the surface of what fractional plasma can do. I predict that this will replace many of the resurfacing platforms that we are using today.
Opus Plasma is the first fractional plasma RF technology with the tunability and treatment versatility like a fractional resurfacing laser.
Fractional plasma technology will change how we think about resurfacing. If complete CO2 resurfacing was resurfacing 1.0 and fractional resurfacing was resurfacing 2.0, today's fractional plasma technology is resurfacing 3.0. Every clinician needs to experience this technology firsthand.
It's compact, it's easy to use, it provides consistent results with little downtime.
I've had a really great experience working with Alma. They've been very receptive to feedback, any alterations.
Alma truly captures the essence of industry-physician relationship. The company understands that the success of any technology needs to be driven by solid science and clinician feedback. And that is why, time and again, Alma has produced devices that satisfy both patient and physician needs.